A lot of fear this afternoon for some Chicago area agencies after House Republicans narrowly adopted a budget resolution. That proposal raises the debt ceiling, but it also comes with huge cuts. It slashes at least $2 trillion, and that could impact Medicaid, nutritional assistance, and veterans benefits. Senate Republicans have already said they want to avoid deep cuts to Medicaid. Joining me now to talk about this is Mark Ishaug. He is the CEO of Thresholds, which provides mental health and substance use services for people here in Illinois. Mark, thank you for being with us.
Thank you for having me. Good to be here.
Yeah, I know this is a topic that's looming large in your professional world right now. Your group receives millions of dollars from Medicaid. So what does really any kind of cut to that program mean for yours?
Well, really any kind of cut to Medicaid for a place like Thresholds and those we serve, people with serious mental illnesses and drug addiction and histories of homelessness, it would just be devastating. You know, we're a big organization and we serve about 10,000 people, but our budget is built around Medicaid, both the state and federal match.
How are you preparing in case this happens?
Our budget is about 70% federally funded, and the combination of Medicaid, state Medicaid, and then the federal grants for housing, for youth and young adults, for senior citizens. So like many organizations, because we serve the most vulnerable and the most at risk, we cannot do this work without Medicaid and without federal funding.
I know the state funding is part of your budget, but it's not like Illinois is rolling in dough to where they're filling the gaps in that funding for so many groups like yours.
Yeah, no state will be able to make up these federal cuts. And the so-called red states are among the most vulnerable programs in Illinois, in rural areas where rural hospitals are at risk. This really affects every single person across all 50 states and territories. You know, when I think about a budget, I think a budget and a budget resolution as a moral document. And what we were presented with last night from Washington, D.C. is immoral. This puts 70 million people at risk. It puts our communities, our hospitals, our mental health centers, our primary care clinics, everything that we have worked for to make our clients and our communities safer is all at risk.
Thank you for speaking with us about the impact and what is happening next. We appreciate your time.